Hi, everyone, and thank you for joining us today. We're really excited as the California Telehealth Resource Center to be offering today's session, The Future of Telemental Health, given by Raymond Barrett, the founder of the Telehealth Certification Institute. A few tips for today's session. We are in Zoom meeting, so we are going to encourage you to, while you are muted on entry, feel welcome to turn on your video. We'd love to see your face during the presentation today and see who's in the room. We do have chat enabled, so during the presentation, if you have any questions or feedback for a presenter, please feel free to use that chat as much as you'd like. As a reminder, today's session is being recorded, so the recording and slides will be made available on the CTRC website and on our YouTube channel by the end of the week. One last reminder for everyone, today's session is purely for informational purposes. CTRC does not provide any legal advice, nor do we have any relevant financial interest, arrangement, or affiliation with any organizations or commercial products or services mentioned in today's session. And with that, I will hand it over to our wonderful presenter today, Raymond Barrett, to inform us, educate us, and share some knowledge. So Raymond, it's all you.
All right. Thanks a lot. Good to be here again. I really enjoy this topic, the future of telemental health. I've been spending a lot of time thinking about it. Let me tell you a little bit about who I am. So yes, I'm Ray Barrett. I'm a licensed mental health counselor. And ever since I started providing counseling services, it's always been virtually. My first client wanted sessions over the phone. So from then forward, I've been providing telehealth services. I did also have a brick and mortar office where I provided services for a fair amount of years in conjunction with telehealth. And then I went strictly telehealth probably 8-9 years ago. So in doing telemental health, I realized that there was a real need for clinicians to learn how to do it. The training out there to me did not seem very practical. So I wanted training that was super practical. People can learn, the nuts and bolts, like how to actually do it and get off the ground running. So I started providing training to clinicians on telemental health. Probably 13 years ago. Started our training institute 9 years ago. And so we train clinicians and organizations on telemental health across the country and internationally. So the organization is the Telehealth Certification Institute. We also provide a lot of resources. And we have a comprehensive training on telemental health, but also a lot of specialty courses on telemental health. So, before doing counseling, I also did coaching, and almost all of my coaching was virtually. So basically where I come from in regards to telemental health is I have a passion for it. And where it comes from is I like doing things that are really convenient and that work for the end user, rather than having to fit into a box for whatever particular reasons. And so when I was doing coaching, it was just so flexible, hey, what works for you? If a phone call works, great. If a 15-minute phone call works, great. So yeah, I have a real passion for telemental health because of how innovative it is and so forth. So just to start to set the scene here of what we're talking about, telemental health. What is it? So it's simply providing mental health care where you and the client are not in the same location. We all know that. But it is important to kind of frame what I'm talking about here, because mental health services is very broad. The use of technology in mental health is very, very broad. So I'm trying to focus here on providing services directly to clients remotely. And what does that look like? But also to kind of provide a scope here in terms of what we're talking about. There's mental health care, very broad, right? So licensed clinicians in the framework of insurance reimbursement is not the only way people get treatment for mental health. So mental health care is where people are seeking support, assistance, help for mental health struggles and to improve their mental health. So they don't have to be ill or anything like that. They just want to improve their mental health. And so they're going to do that, like in any industry, any market, in ways that are affordable, that are effective, that are convenient, that are private, right? That fit their needs. But in this discussion, what we're primarily focused on is a much, much more narrow focus than that. It's within the framework of licensure and healthcare insurance reimbursement, which does make things much more restrictive. But I want to give kind of want to make that distinction. Telemental health, providing services remotely it's nothing new, right? Back in the very beginnings, even using Morse code and NASA way back. So even Sigmund Freud, how do we know so much about Sigmund Freud's therapy? Psychoanalysis, because he wrote letters back and forth between himself and clients, a lot of them. So providing services remotely is like nothing new. Even when they came to his office, he still didn't even have them look at him. So yes. And then in 1959, we had where they used television sets. Television's usually one way. They made it so it's two-way for the psychiatric department at the Nebraska Medical Center. So this stuff goes way back. And then even bots. So ELIZA in 1964 is created, where it was just simply a computer program that would respond to the end user in a fashion that resembles Carl Rogers' way of communication with clients. If you're a counselor, you probably learned that style of communicating. And that's just continuing to be improved upon significantly. And then in terms of telemental health, there's been standards for it for quite a long time. The Center for Credentialing and Education, they had a credential for it starting in 2004. It was called the Distance Credentialed Counselor. They had ethical standards for providing distance counseling. So goes back. Now, the thing that's different today, the reason why we're talking about this now is probably because a lot more people are utilizing it. So it's not that telemental health is new. Telemental health is absolutely not new. But the utilization of it is what has drastically changed with the pandemic. So the ways that, in terms of using technology, technology can just simply be used as a medium of communication, like we use video calls, phone calls, etc. But in terms of treatment, it could also assist with treatment. So you can have a computer program, an app, whatever, that you have your client use along with the time that they're in treatment with you and receiving psychotherapy sessions where they're coming to your office, etc. But then you also have technology that just simply provides treatment without a clinician, no clinician at all, just technology providing treatment. And that happens now outside the realm of insurance reimbursement, etc. And that area, I think, is up and coming. And I know a lot of clinicians worry about that. I think a lot of times clinicians worry about job security and what is technology and technology providing treatment going to do to job security and so forth. There's concerns about that. But so basically, it provides a medium of communication. It could assist treatment that the clinician is providing, or it could just simply provide treatment. So the technology we're using currently for telemental health that we've been using for a very long time, we've been using the phone for ever, and then video conferencing and then texting and so forth. So some of the restrictions, limitations that we've had within the scope that we're talking about in terms of licensure and insurance reimbursement, of course, is training. So when I got that call, my very first client, when I opened up my private practice, this woman found me on the internet, and she thought I'd be a fit for her husband as a counselor. And this person was a salesperson on the road all the time. So he was always on the phone. So he wanted phone counseling. Well, I didn't learn anything about how to provide services remotely. When I was in graduate school, I wasn't tested on it, none of that. So why? We've always communicated through the phone. It's not new. The phone goes way back. So there's a lot of resistance from clinicians with telemental health because they were never trained on it. It's just kind of new to them. So that's different now. So now it's in graduate programs. So now clinicians are being trained on telemental health from the beginning, being supervised on it, experiencing it, practicing it, honing their skills. So now, with the new graduates, things are going to be way, way different in terms of that. There's also the restriction of reimbursement, as you all know. Limitations on where the client can be, and do you have to see them in the same room at some point? Are they going to reimburse for audio only sessions? I mean, all of these things have been restrictions that have always driven me crazy. Because a lot of restrictions and legislation and so forth has not seemed to be based upon research to me. So those have been limitations that luckily we've been seeing movement on. And then, of course, licensure in the United States of America. We're kind of unique in that way, where licensure is state by state. They're the ones that have the power and authority to enact licensure law if they choose. They don't have to, but they all have, which prohibits people from either providing a service or using a professional title that they hold somewhere else, but they can't use that professional title and providing services in another state if they're not licensed in that state. So yeah, that's been a huge limitation. So where had the doors opened, right? So you're aware of a lot of these things, right? The telehealth parity laws saying, hey, if insurance companies, health insurance companies, are going to reimburse for particular health services when they're provided on site, hey, they have to reimburse those when they're provided remotely also. So that has made a difference. There's research on that states that have had more telehealth services provided. And then in terms of licensure, seems like compacts is going to be the solution. So ever since the pandemic, those compacts have been really increasing quite a bit. Like, we've had the compact for physicians for quite a while, and for nursing, and then the SciPac, and now we are going to have soon one for counselors, and they've had a lot of states sign on to that quite quickly. It's really impressive, and I think the reason why they had such success, one of the reasons, of course, there was a learning curve with the other compacts in the past, but also because of the pandemic, everyone's seen how important this was. And then the pandemic loosened up a lot of regulations. But then again, like I said, education, people being trained on how helpful this is and experiencing it firsthand. So yeah, a lot of these restrictions are being dealt with. And now we're kind of moving into a realm of new technologies that are kind of in the infant stages, where there are some legitimate concerns about privacy and security, et cetera. So some other kind of limitations or restrictions on the more broad use of different technologies for telemental health. One is the quality of the technology. If you think back to, the beginnings of video conferencing, where, video conferencing was pretty clunky. Mobile phones were more clunky. You had to have pretty decent bandwidth to have a good video call. Calls would be dropped, etc. So video conferencing in of itself, the technology is significantly improved. So with these new technologies, we're kind of in beginning stages. These technologies have been worked on for quite a while, but yeah, we still have a ways to go. The other piece is the privacy and security, and those are legitimate concerns. And I'm really curious as to what's going to happen there with privacy and security. I have friends who work in some big tech companies, and they share with me that they have an incredible amount of data and information on individuals that we're not that the public's not usually aware of. So yeah, how to regulate that privacy and security issue is a serious concern. So some examples of like significant improvements with this technology. If we just simply look at video conferencing, I don't know if you've seen any like YouTube videos, the demos of these things, but Google's Starline project, Google has video conferencing now where there's like multiple cameras, so it presents the person as though they're right there with you. It presents them like you experience it almost like it's three-dimensional. I haven't used it myself, but I've seen videos and testimonies of people who have tested it out. And then Logitech has one that's very similar, Project Ghost. So these require quite a bit of technology, but that the average person is not going to be able to afford. But if you think about even cameras, how cameras have advanced, these and computers, how they've downsized. So I'm interested in how even video conferencing itself is going to be drastically improved, so that it's more of a in the same room kind of experience. Now, I mentioned Doxy.me for video conferencing. Again, I'm not promoting any company or anything like that here. But I've tested out many different video conferencing platforms. And one thing I noticed during the pandemic was that Doxy.me was widely utilized. And what struck me about that is Doxy.me, they made their video conferencing so incredibly easy to use. So I believe that's why it's just spread like wildfire. So, if you haven't used Doxy.me, you simply get a URL of your waiting room for your clients to come to see you for their sessions. And so in my estimation, it's secure, and it does the job. But the fact that it was just so extremely easy. So making technology easy, secure, trustworthy, and having the quality really high. So again, some other technologies that are coming into the market, that's what they're continuing to improve upon. So some other technologies that are being used and that will be used more and more so. Now, I don't have a crystal ball, but these are out there. And I know that an incredible amount of investing is going into the development and improvement of these technologies. So I know you're aware of avatar programs. An avatar is if you play a video game, you play a video game with your kids or you do it yourself. Often you'll create a character to represent you in the game, so you can decide what they look like and so forth. And then virtual reality, right? Wearing the goggles, where you experience like you're in another world, and that's really cool. And then mobile apps, right there on your mobile phone or tablet or whatever your watch that you're walking around with. Remote patient monitoring, bots, digital therapeutics. So I'm going to go through some of these and just kind of share information of different technologies that I've seen that are out there. And artificial intelligence is significantly improving each and every one of these. So in terms of prevention, so how do you determine if someone is becoming depressed or anxious or having suicidal thoughts or at risk of relapse, all those things, right? Like, let's catch these things early rather than having to wait till they're at their breaking point. That's often how I've experienced traditional counseling to go. Traditional counseling, it costs a lot of money. If you don't have health insurance, there's a stigma. You're going to someone who you don't know anything about. You don't know this person. They don't know you. They don't know your history. You might be going to a foreign environment, right? So sometimes people wait until things get really bad to seek counseling. So let's catch it early. So some examples of that are Lifebuoy and Oi. And I recommend that you take a look at these. So Lifebuoy it's a suicide prevention app for adolescents and young adults, and it looks at data that it collects on their mobile devices to find out when they're at risk. In Vibe Up, I'm in Oi is another suicide prevention app, and then they can also be used for assessment. The assessment is another thing I'm very, very interested in, like diagnosis. So, diagnosis in the studies that have been done in terms of the reliability, you take 10 psychologists and have them come up with a diagnosis for a client. And, about 50% of the time they'll agree on the diagnosis. So, and then the information they're going with, you have assessments, but often it's the interview, right? The information that you're just getting verbally from the person that you're assessing. So with assessment, I'm using technology, especially with the remote patient monitoring, getting some hard data where you can track the person. And the assessment could also be much more personalized. So rather than looking at, hey, out of my experience of working with, 2000 or 2000 clients with depression, this is what it looks like. Like the technology could become much, much more personalized according to the person that you're working with. And then for the treatment planning, well, what treatment works? I don't know if you've ever thought about getting counseling for yourself or for a family member. But if you have, what therapy modality ought you seek? Should you be seeking a clinician that's an expert in CBT or, you name it, EMDR, person-centered, motivational interviewing, like what's going to work for your situation and for you particularly at this moment? Really works. So that's a tough one. And then when clinicians say that they practice a particular therapeutic modality, do they really? So yeah, so this app Vibe Up as an example. What that's looking at, well, this is looking at personalized care, but what it does is they will treat you very briefly utilizing different treatment techniques. And then through the data that they get on your mobile device and your feedback, they'll identify what's actually working for you. And the thing that's cool about technology that humans are not able to do very well is, well, think about this. When I took standardized tests back when I was in school, it was all pencil and paper, right? Fill in the box and all that kind of stuff. So you had to you had to answer a lot of questions. But now when you take a standardized test, what it does is it continually modifies itself according to your previous answers. So rather than having to answer 50 easy questions, if you answered 3 easy questions right, it's going to jump you to the next level, right? So this, this smart technology, it's what they do is they're quickly identifying what type of treatment is working for the individual. And then documentation. We have ambient listening devices that document for clinicians, and just make, documentation is the thing that most clinicians just hate and don't do very much. And then treatment itself. So avatar programs. Second Life has been out since 2003. And early on when it came out, I tested it out. I became a user, and it's really impressive. And I knew that behavioral health clinicians were utilizing it to provide therapy. It's a virtual world. You can create the environment that you're going to interact with other individuals in. You can create your avatar, and counselors would create their offices in this virtual world. But knowing HIPAA law and being a covered entity under HIPAA law, I did not use Second Life because they do not provide a HIPAA business associate agreement, which is a really good standard for privacy and security of healthcare information. It's a really interesting avatar program. Now, there's others out there like Mersion's where you can create scenarios using avatars for training. So like there's a graduate program for behavioral health clinicians that's using Mersion to train their clinicians. So you can customize these scenarios and have them play out these scenarios and get practice and feedback. And they're really cool. Voki and Cognito, they're also avatar scenario-based training programs. So for education, it's really helpful. And you think about not just for clinicians, but for clients. So augmented reality and virtual reality. So I'm sure you heard of the metaverse. I tested out the metaverse because there's someone who creates counseling offices for behavioral health clinicians in the metaverse. Of course, again, there's issues there with HIPAA law. So VR, virtual reality, the VR and VA, Veterans Administration has utilized VR a lot and has seen really great results. And it's important to look at these studies because what they've learned from utilizing virtual reality with patients is really helpful, like how to prep them, how to assess whether or not they're getting sick from it, nauseous and all this kind of stuff. And like, in the fact that, like, let me give you an example. When I tested it, I did not feel good afterwards. I used it for about 25 minutes. I was like, oh, I was feeling kind of nauseous. And so I'm like, forget this, and just never used it again. And then I learned from these studies that that's normal. And the more you use it, the less that happens to you. So that was interesting. But here's an organization that uses it for substance use disorder treatment. Here's a study you can look at where they used it for patients with dementia. It's really interesting. Even older adults enjoy, like from these studies, they enjoyed the VR. So now apps could be used just to provide information, again, assessments and crisis response, and self-care and treatment tools, etc. But one thing that's important, if you're going to use an app with clients, there's several things that are important, but overall, it's how do you evaluate these apps? So the fact that you're here, you're probably aware of the American Telemedicine Association. I was on one of their task forces, or like what they call us, a task force, I guess, to come up with a guide for evaluating apps for depression, for treating depression. We met for like 6 months working on this project. It was really interesting. But yeah, there's several things you really ought to carefully evaluate when using mobile apps with clients. You may have seen a recent article that showed where they looked at about 36 different apps to see whether or not they were sharing users' data with third parties, and every one of them other than one was. So because they would have tracking code on their apps. So here are some guides for reviewing mobile apps. I'd become familiar with these. So the AMARS goes back quite a ways. The AMARS was developed in 2000. Well, the MARS was developed in 2015. It was in Australia, and then it was revised, got the AMARS. So that's for healthcare in general. The APA, American Psychological Association, they have an app evaluation model, and they don't evaluate maps. And they don't evaluate apps, but they have a guide in terms of how you can evaluate apps. And then Cyber Guide is a website where they do evaluate behavioral health apps. And then the Agency for Healthcare Research and Quality, they have a framework. It's called FASTER, Framework to Assist Stakeholders in Technology Evaluation for Recovery. So these are all, so again, you want to make sure that apps are evidence-based, they do what they say they're going to do. What are the appropriate use cases? Are they sharing data? Are they truly private and secure and safe? And should you use them alongside the client or just hand it off to the client? How does HIPAA law get involved with you either recommending or utilizing apps with clients? All these things are really important. And then remote patient monitoring. I'm not going to spend much time on this, but I think this is going to be a huge, huge game changer. There are so many different wearable devices that are being launched for remote patient monitoring. Like I know an organization in Louisiana that's been working on just specifically for behavioral health, a watch to capture a whole bunch of biometric data for assessment, treatment, and so forth. Because if we can get real-time data from clients, even for our, you think about yourself. If you've ever struggled with anxiety or depression or any of that kind of stuff, think back. What was that like? Did you know that you were depressed or anxious? How depressed or anxious were you? Should have you sought help, or were you kind of just struggling a little bit and can just push through? What was really triggering it? What was causing that? And what made you better? So those things are tough to figure out. But if you can, so the remote patient monitoring, like getting the, blood pressure, temperature, even the perspiration on your skin and all this stuff, your movement, your breathing, your tone of voice, and all this kind of stuff is super interesting. And this gets into phenotyping. Phenotyping, what it does is it looks at the behaviors of something, like in this case, humans, right? So looking at the behaviors of humans, and that way you can categorize and determine, is an example, they're doing phenotyping with mice to determine the impact of psychotropic medication. So what happens is they watch the mice, and the mice have they identified 56 different behaviors that the mice have. And and using technology, they can look at the patterns of these behaviors and the impact of medication on these behaviors. And then they can see which medications are similar to the others, and they can figure out how are these medications working, which one's similar to the other, all sorts of things. So we have digital phenotyping, which is looking at the digital behavior of people. So, I've heard years ago that Facebook is able to identify with very good accuracy whether or not someone's becoming depressed simply by how often they're posting, what they're looking at, who they're connecting with, what time of day they're, on Facebook, all these kind of things. So these online behaviors, we're able to say, yeah, this looks like depression or anxiety or you name it. So phenotyping is a big piece of that. And then bots. So you're probably familiar with bots with customer service. So with most websites these days, there's a bot. Well, first of all, with most businesses these days, try calling them and talking to a human, right? I hate it. I hate calling businesses and getting a bot. It frustrates the heck out of me. I'm like, can I talk to a human, Homo sapien, something with consciousness? I just don't want to talk to a bot. So yeah, and they do this because, apparently it's cost efficient. So on websites, you have a bot, you can type a question and it will try to narrow down an answer for you. I find that they don't work very well. So you have those, and then you have voice activated assistants on your mobile devices and your computer and all this kind of stuff, right? Alexa and so forth. And the thing about these is they're so convenient and they become so helpful, and they're becoming part of our day-to-day activities, right? We're at dinner as a family and we're like, I'm not sure about that. Well, let's ask Alexa, right? Let's ask Alexa. So yeah, these bots are, people get really connected to their bots. So the problem is that a lot of these bots, they use tree diagrams to come up with the answers to your questions, and they're based upon scripts. But with artificial intelligence in generative AI, right? Where generative AI, it's able to generate answers based upon natural language processing. It's able to process just natural language. So it's able to communicate with you just like any other human could. And it's getting better and better and better. So when you interact with these apps, people want it to be just very natural. So there's been studies done where it shows that some of these bots, people cannot tell they can't tell whether or not they're talking to a human or a bot. I'll mention later that the bot Wobot for behavioral health. And when I first used Wobot, I would ask trick questions to let's make it clear that you're a bot. And asking these trick questions made it very easy to identify, yeah, this is a bot, not a human. But Lumen is one that's being studied. And Lumen is a voice-based coach. So most bots for behavioral health have been text. This is a voice-based bot. And these things, people are putting a lot of investments into these things. So with Lumen, they're using the generative AI, natural language processing, And they did neuroimaging of the people they did this study with, and they showed that it's quite effective. And by getting feedback, they're able to just fine tune this app and just make it better and better and better. Like what Lumen did is it provided a problem solving treatment. And the participants said, well, sometimes it was kind of overwhelming. It was too cognitively heavy on me. So they're like, okay, so they broke the steps down into shorter steps. They also made it so that you can go back to the prior step and pause. So they're constantly adapting these bots. And if you think about behavioral health care, what would you want if you were receiving behavioral health care, right? Like you might want to remain anonymous. Yeah, you really want it to be private. You want it to be when you want it. You want it, you want it kind of it to be predictable, stuff like that. So if you look at the websites of some of these companies that provide these behavioral health apps, like they'll say, you know, you're anonymous and you could just get help whenever in unlimited help, which is really attractive to people. So another thing is digital therapeutics, and that's kind of like a pharmaceutical where digital therapeutics it's an app, a computer program, but it has to go through that same rigorous process that a pharmaceutical medication has to go through with the FDA to be approved as a digital therapeutic. So here are some digital therapeutics specifically for behavioral health, like Esteem is for ADHD, and I don't have time to go into it, but these apps are really neat. Like Esteem does a whole bunch of stuff. And then you have Reset and Reset O for substance use disorder treatment. So the other thing that I think is up and coming, it does exist to some extent, but I think this is what's going to be huge. It'll be interesting to see what we do with it, is technology providing treatment itself. And I know there's a lot of resistance from clinicians for that. Clinicians say, "Oh no, you need a human involved. You can't trust a bot. You know, you need a human to verify and so forth." So I think the things that need to be considered here, whether you're using a computer program to provide treatment or a human to provide treatment, is it safe? Are there errors? What are the risks, privacy risks? Is there bias? Is the technology or human acting out on their own best interest or their own issues or their own countertransference? So is it safe? And then can it be modified to the individual? Is it effective? What about the cost? Is it convenient? Is it compliant with, say, codes of ethics and laws, like providing care coordination, documentation, and so forth? Is it predictable? Is it confidential? Does the client feel free to express themselves and really get the help that they need? So in terms of technology providing treatment, what I fear, because I've seen how this has gone with other telemental health modalities, even phone counseling, like, come on. But, you know, clinicians have pushed back so hard on phone counseling, like, oh, no, that's not good enough. Now that's, you know, doesn't work so well. Really? Like, where's the data on that? So I think with the use of technology, we really need to put these things to the test. So what is more effective and safe and all these kind of things? But then, you know, there's other things that come into play that we have to consider is, so who's liable or responsible if something doesn't go right or doesn't go well? and like I mentioned, the privacy and security and HIPAA law and all those kind of things. But when we talk about HIPAA law and so forth, again, that's still within the framework of insurance reimbursement. So if technology providing behavioral health treatment is convenient, safe, effective, person-centered, et cetera, people will use it whether or not insurance reimburses for it. So it'll be really interesting to see where that goes and what the research shows. Some other uses of telemental health that are already out there, you may be aware of, is the patient portal. So you've all experienced patient portals. Patient portals are really powerful, and people are getting more and more used to using patient portals, connecting with the provider. It's just how much more convenient is that rather than having to schedule the appointment or call the office and then the patient portal is super helpful. And then even for drug testing, the technology has improved so much. As an example, this product Proof by Recovery Trek, the cost is almost the same. People get sent out the test kit, they can get the results right there and then, or they mail in the samples and it's verified through facial recognition and on video and all this kind of stuff for, like urinary drug tests and all this kind of stuff. So there's a lot of solutions out there to provide treatment remotely. So in terms of artificial intelligence, you may have already used like ChatGPT yourself or Bard, through Google. People are already using these things for behavioral health. Let me give you an example. So just to test this out, I asked ChatGPT, I said, write me a screenplay of a clinician providing psychoanalysis to a client who's struggling with ... And it writ me this screenplay. It only writes like 3 pages or whatever. I don't know if I had the paid version, if I'd get more or not. But it's really interesting. Like, it writes the screenplay like a psychoanalysis would provide therapy. And I said, okay, write the screenplay if the clinician was using motivational interviewing, and bam, seconds. It's like, there's a screenplay. That was really neat. I thought it was interesting for like training purposes for clients. But anyway, people are using it like a treatment plan for someone struggling with ... And it gives like, these suggestions, or, give me a relaxation technique that I can use when doing this. So just the convenience and how quickly these things can provide information. Now, the caveats here, like, of course, these, the programs I'm mentioning so far, like Bard and ChatGPT, they are not for healthcare use. The companies say that themselves, and the AI is just coming up with things. It could be dangerous and not private. That information is going into the going into the program. It's being stored. So yeah, you're not going to, do not put any patient information in there. Recognize its limitations and so forth. But where this is going is pretty exciting in terms of what it can do for us. And of course, have to consider HIPAA law and codes of ethics and so forth. So here, in terms of evaluating artificial intelligence for healthcare use, I would check out the Coalition for Health AI. These are a lot of physicians are a part of this, trying to come up with protocol or guidelines to evaluate artificial intelligence for healthcare. an example of using artificial intelligence specifically for behavioral health. And again, I'm not promoting any particular company. I haven't thoroughly evaluated many of these companies. But the LYSSN, this program's really interesting. It will analyze sessions through recordings. So let me give you some examples of when you would use a program like this. Say you're a clinical supervisor and you want to make sure that your clinicians are asking their clients whether or not they're having any thoughts of suicide, or like for compliance reasons, for any evaluation reasons, or how empathetic are my clinicians being, or how empathetic am I? Or let's say your practice provides motivational interviewing as a particular technique. Can you advertise that? We provide motivational interviewing. Well, this program will analyze your sessions and tell you whether or not you are following motivational interviewing protocol. Like, how in alignment are your sessions actually with motivational interviewing, and where are the areas for improvement? So think about the incredible possibilities here. We talk about microaggressions and bias and prejudice and countertransference and all these kind of things. If we could use AI programs like this to actually analyze our sessions for continued improvement. So for writing notes, Mentalic, I guess is how you pronounce it. This is a program where you input your recordings of your sessions, and it will quickly provide you your progress notes, or it has several different types of notes. Clinicians really don't like writing up notes. I would say most clinicians don't write their notes. So this program will write your notes for you. And then of course you could just review your notes. And this one's specifically for behavioral health. So Nuance, you probably heard of Dragon, where Dragon's the speech to text program. So they, in conjunction with Microsoft, they have a program that will create the case note for different healthcare fields, where it's just an ambient listening device. So you don't have to submit a recording. It'll just listen in on the session. Right when the session ends, it'll create the note. And clinicians find that it puts a lot of things in the note that the clinician wouldn't have even thought of. So yeah, it's really interesting. Yeah, so these are some AI programs specifically for healthcare that Microsoft and Google are using and working on. So looking at medical images. So this stuff is certainly up and coming. So even to assist the clinician, because there are a lot of things a clinician is not going to see or notice that an AI program will. So like, we talked about ChatGPT. Epic is integrated ChatGPT into their EHR. I don't know all the details of how they did that safely and securely and to what extent. But in terms of finding information on clients, putting information, summarizing information, all that kind of stuff, doing queries, these generative AI models are being used. Social media is a powerful source of providing treatment. So what do we need? Where do we need to go from? Where do we need to go from here? Because the technology is just exploding, right? One is careful evaluation of the technology before using it. So that's what we do at our training institute. We train clinicians, and sometimes they're like, "Well, there's a lot of information about privacy and security and ethics and all that kind of stuff." But there's so much to know because, okay, so the error that I see most clinicians fall into is they assume that since they use technology in their personal lives, hey, you could use it for healthcare. And that's not the case. Before it's used for healthcare, we have to go through a very rigorous process to make sure that it's safe and appropriate, and that it's private, and that's complying with codes of ethics and privacy law and licensure law and all this kind of stuff. So we want to be careful. And then the other thing is, the biggest error is the human error when it comes to technology. So getting training, clinicians being trained adequately on how to use these technologies before using them. And that often doesn't happen. But yeah, very, very important. So just to summarize, before we could maybe take a question or two. So again, I'm Ray Barrett with the Telehealth Certification Institute. What we do is provide training and also consultation. So if you need any support, we don't have the bots. If you call, you'll get a person. If you email, chat, text, all those ways, you'll get a human. We'll support you on those things. So this has been a pleasure. I hope it's been fun for you. Hope you got some information of different technologies out there. And yeah, do we happen to have a question?
I'm not seeing any right now. I've gotten a few about slides. I know there's been a lot of cool links and helpful information shared in the presentation. So just a reminder that we will have those slides available. Actually, they're posted. So I'll share the link for that. But if anybody has any questions for Ray, now's a great time to drop that in. Yeah, I also want to give everyone a heads up that we do have our next session for July posted. So join us on July 18th for telehealth and artificial intelligence. Okay, looks like we got one question for Ray. Any experience with FQHCs? You want to speak to that a bit?
Well, my personal experience with FQHCs is one of the first trainings I did was for an FQHC, providing a comprehensive training program on telemental health for their staff. They were doing some pretty neat stuff. Gosh, like 15 years ago, they bought a bunch of telehealth equipment. They were doing telehealth for migrant workers out in the field in a car with a laptop. And but in terms of insurance reimbursement and being a an originating site for patients for reimbursement, et cetera. So we do communicate with FQHCs and done some work with them. So feel free to reach out to us and we'll see how we can help you.
Yeah, sounds great. It's always a pleasure to collaborate with you, Ray, and have you. You got a lot of great resources available. So thank you for joining us today and sharing so much really cool information, a lot to think about, lots of cool, exciting stuff happening in this world. So everybody's saying thank you so much. It was a wonderful presentation. So thank you. It's a pleasure. And I'm sure we'll see you again soon.
Excellent. Thank you for having me.
Okay. Thanks, everyone, and have a great rest of your day. Bye.